COVID-19 has been a particular disaster when it comes to American nursing homes. By some estimates, 1/3 of all American COVID deaths, or perhaps more, happen among nursing home residents. And more, it's becoming a political headache for New York Governor Andrew Cuomo, following new reports asking questions about his pandemic leadership, including nursing homes, and the new reporting that Cuomo had burned through at least 9 top-level health officials during the crisis, often removing them from the decision-making process, and that local public health officials and even hospitals didn't know about new policies Cuomo was implementing until they heard it when he delivered them live at press briefings. It is also important to note that the report that we're talking about, it didn't come from some critic of the governor, but in fact an ally. I'm talking about State Attorney General Letitia James. The report says that the number of nursing home resident deaths in the state was actually underreported, and by a huge number. Cuomo noted that the new information didn't change the overall numbers of fatalities in New York through COVID, just in how and where the deaths of nursing home residents were reported.
The Department of Health only counted the number of deaths in hospitals and the number of deaths in nursing homes. Release that number stays the same.
Report also shed light on another problem: COVID-positive nursing home residents who were treated in the hospitals but then returned to their homes while they were still testing positive for COVID. More than 3,600 residents fit that category, impacting 310 different homes, while families with at-risk loved ones were most likely not notified. Report also says that new COVID rules from lawmakers led to confusion among nursing home operators, that some state nursing homes didn't take the proper precautions for dealing with COVID-positive residents, and also that some nursing homes underreported deaths in the data that they had to file with the state, in some cases giving dramatically incorrect numbers. I want to bring in our guest, Neumann. She's a reporter and author. She's focused on the issues of concerns to seniors, including nursing homes, well beyond just the state of New York. And she's also author of The Good Death, an exploration of dying in America. And Ann, it's good to talk to you again. Thank you for giving us a few minutes here. You've seen what's played out in New York, and I'm curious. The governor would like to say basically this is just a distinction without a difference. The denominator is the same in terms of how many people died, whether it was because of being infected in a nursing home or not. It's 6 of one, half dozen the other. You don't agree with that, do you?
Of course not. I mean, where people died really matters, because how do we address infection control in the future if we don't know how we've done it in the past and what we've done wrong? And we see this with the governor again and again, putting politics over lives of individuals, trying to save his political skin, as our elders were pretty helpless and being shuffled from place to place.
Nan, I've been following your reporting on this in The Guardian, and the takeaway, and tell me if I'm getting this wrong, is by a lot of states, there's almost a hear no evil or see no evil, hear no evil thing, which is, yes, there's oversight that's supposed to happen of these private homes, but the less the state really pries, the less they learn about problems they have to deal with. Oversimplification, but do I have it mostly right?
No, that's absolutely correct. And we've known what the problems within the nursing home industry are for a while, but even large newspapers like the New York Times have really failed in understanding that narrative clearly. In fact, in 2019, I believe March of 2019, a famous reporter named Jack Healy wrote a large piece about the closures of nursing homes in rural states across the country, particularly South Dakota. And if you look at that information, it's very clear that these homes are not closing only because Medicare and Medicaid payments from the state and federal level are lower than they should be. We haven't prioritized that, but also because the industry is largely unregulated and rampant fraud is causing these strings to be bought up by profit-driven corporations, literally sucking the life out of these entities, and then the entities are closing. And that's one more way that our seniors are being put into a terrible situation. They don't have good long-term care, and states don't want to take care of these facilities themselves. They don't want to get involved in that.
And one of the things that surprised me, and I have a loved one nursing. Nursing homes can be literally separated by only miles, but the quality of care from one to the other, and we've seen this by the outbreaks where COVID will spread through one facility versus the other. And not to be crass, but a lot of this comes down to economics. I learned from your reporting the average nursing home attendance take home is 19 grand a year. And they are for profit. They're concerned about margin. And it's going to be oftentimes, not always, but oftentimes you can see this reflected in care. And my question is, since the outbreak of COVID to where we are now, how much better has the quality of care gotten given the acuteness of the virus they're dealing with?
Oh, it's worse. We're in a moment of time where the care of individuals is worse. Staffing is so low right now. There are reports of one staff member or one aide to 24 individuals. Residents are not getting bathed. And there are 5 states right now where I think that the death count of patients is right around 4 per 100. And those states are in their own wave. You know, New York's came earlier last year in March and April. But in states where that wave of COVID is still very high, the care that individuals are receiving is decimated. And this staffing issue, as you mentioned, with low pay, is a chronic problem. It's been going on for years.
And one of the things that, to a layperson like me, never made any sense is if somebody went to the hospital to be treated for COVID, they still got it, who in their right mind would send them back to a nursing home, in many cases with a roommate who's uninfected here, and you can obviously see the logical spread. Was that just an oversight? Should the nursing homes have been waving their hands? Did they wave their hands? And tell me that's not still happening.
On March 25th, Cuomo decided to alleviate the pressure on state hospitals by having individuals sent to nursing homes. That is a blatant sacrifice of elder lives, as though those lives don't matter or don't have the same value as others. I don't understand the sense behind the policy. It was panic mode. It was a politician interfering in health law. And as you mentioned in your fantastic opening, the governor has a tendency to do that, to not trust the experts around him and to do what is politically expedient as opposed to what is best for public health. And we're seeing that again and again. Individuals who are in positions of power, who don't understand the disease that they're dealing with and are doing the most politically expedient thing. And I think in many cases, nursing home operators are also have also operated under those policies, those decision-making tenets, and it's been deadly.
I'm sure there's people in our audience right now who have a loved one in a nursing home or are considering that as an option for an elder member of their household. Give advice in terms of what are the questions they should be asking, what are the levels of oversight that they shouldn't just trust but verify. Walk somebody through right now, if they're going through this process, what kind of answers and not just what kind of questions they should be asking.
Yeah, stay in touch with your loved one as you can, whether it's with the telephone or an iPad video, something of that sort. Call and talk to staff and know the staff that are surrounding your loved one, whether it's the day staff and the night staff. Find an ally on the inside that you can talk to, that you can get regular updates about your loved one's care. If you're talking to your loved one, find out what kind of care they're getting. What you can also do is make friends with management. You want to know what's going on. If you have suspicions that your individual loved one is not receiving the kinds of care that they need or require, you can contact the federally appointed ombudsman. And this is different in various states across the country, but a federal mandate has determined that ombudsmen represent every facility in the country.
I remember covering when the VA hospitals were under a lot of scrutiny, an ombudsman at a couple of the VA facilities literally being the lifeline and also the agent of change there. So I think that's some terrific advice. Ann, good talking to you as always. Thank you.